Hey you guys, so I basically wanted to go over the at-home care tips for whenever you come home after getting the initial biopsy. They when you get it done, you cannot wear your bra out that you went in there with. At least I couldn't. You have to have something that is really going to support your breast. So they wrap you in an ace bandage type of deal, and in 1 second I am going to show you how they wrapped me in it. But when they wrapped me in it, you know, it was right after the procedure was done, the biopsy was done, and I had no bra on at that point. And the bra that I did come there with, that I had on me, that I had to take off, you know, for them to be able to do the biopsy, they put it in a bag for me, you know, to bring home. Basically, they told me at home, you know, to just make sure that my breasts were always supported, and I asked if I could wear sports bras, and she was like, yes, that's fine, as long as your breast is supported. So 1 second, and I'm going to put the ace bandage on just to kind of show you over top my shirt what it looked like. Now, when I remember, it's okay, let me try to explain this. I had this wrapped on me after the procedure, okay? So this is the only thing that I had wrapped on my breast after the procedure, no bra. So this instead of the bra after the biopsy. Basically, that's what I'm trying to get at. But I'm going to wrap this around what I'm wearing right now to kind of give you an idea of what it looked like. Okay, so I wrapped it around me right here, and basically this is all they did. They wrapped it around me, and I did not take this off until 24 hours after the biopsy. I went in on May 24th, 2021 at 3 o'clock in the afternoon. I did not take this off or shower or anything until 24 hours later. So May 25th at 3 o'clock in the afternoon is when I could shower after the procedure. Now, they give you an ice pack, you know, for swelling and bruising and stuff like that. You cannot, well, this is what they told me anyway. You cannot take anything other than acetaminophen, which is Tylenol, for pain. No ibuprofen, no naproxen, because those will make you bleed. It will thin your blood. And basically, from what I understand, they want the place where they do the biopsy at to have a blood, you know, to clot up so you don't bleed out or anything. So you don't want to take anything that is going to thin your blood. I mean, that's kind of with like any kind of procedure, though, you know. You don't want to take anything that's going to thin your blood or make you bleed more than what you normally do. So now I'm reading off the paper. Avoid strenuous upper body activity. No heavy lifting for 24 hours. Okay. Wound care. Remove outer dressing. This And I also took they put a brown Band-Aid over top of the little white strips, and I took the brown Band-Aid off after my shower. So it says, wound care, remove outer dressing and shower after 24 hours. Avoid immersing wound in water for 1 week. Wear a supportive bra for 48 hours. You may remove steri strips after 10 days if they have not fallen off on their own. So that's what I was talking about. They put the steri strips over top of where they do the biopsy, and then on top of that they put a like Band-Aid, and then they put some gauze, and then they wrapped it all in that. So you have to leave the strips on, the white strips on there for 10 days. And this right here is from the Band-Aid, so don't get freaked out by seeing that. But these are the right white strips, and you have to leave those on for 10 days. Or let them fall off on their own, is what it says. So, pain with this is mild tenderness, and that's to be expected. Use your ice pack for 20 minutes on, 20 minutes off for 24 hours. Tylenol is recommended for pain, nothing else. What to expect from the biopsy site. You may develop a small knot at the biopsy site afterwards. It will go away after a few weeks, and you may have some bruising. So the one thing that you do need to understand after this is if you get a fever, or you start swelling really bad, or there's like a foul odor or drainage, oozing, it says the oozing is common. You may find blood on outer dressing and or steri strips. For excessive bleeding, apply continuous firm direct pressure over biopsy site and go to the nearest emergency room. So basically it's just saying, like, if you just start bleeding out of the site, a hole where they did the biopsy, go to the emergency room. You know, apply pressure, go to the emergency room. If it starts smelling weird, go to the emergency room. Basically, common sense, you know, that's... The results from the biopsy may take up to 10 days. They told me there that it could take anywhere, you know, from a week to 2 weeks. So if I don't hear from them, don't freak out. It just depends on when they get the results back. And that's pretty much it. I mean, it's pretty much just... I will say this, it's pretty much just all common sense whenever, you know, with anything, I would think, like, the biopsy, after the biopsy, you have like a little bit of pain, you know, but it's bearable. I will say this, make sure you have a vehicle with air conditioning, because I ended up getting sick and puking. We had our Jeep, it does not have air conditioning in it, and I just started puking. Like, I got too hot. And so we had to, you know, pull over and go to a rest area, and I ended up getting like cups of ice and hanging my head out the window and everything. And of course, it was close to 100 degrees on the day that I got it done. So that probably did not help either. You know, everybody is different. One person, it may affect one way, and another person, it may be nothing. Just basically make sure you're comfortable. That's the best advice I can give you. Make sure you have a cool car. You know, you're not too hot. You're not too cold. You know, just, if you feel nauseous after you get it done, tell the doctor, like, hey, I feel a little bit nauseous. And they might give you something for the nausea. Yeah, I think that's about it. I mean, you just have to communicate with your doctors, you know, because nobody is going to not know anything if you don't tell them. So if your nerves are acting up and you feel like you're going to puke because you just got yourself worked up after getting the biopsy, and you've worked yourself up so much that you are feeling sick to your stomach, and you don't tell them, they're not going to know to give you something to help with the nausea for when you leave there and you get in a car and you're going down the road and you hit a turn. Next thing you know, you're puking. Like, yeah. So just communicate with them and tell them what you're feeling, and I'm sure they will try to help you with all of it. I mean, they're there for you. They're there for, you know, to make sure you're comfortable and help you through this process. So don't be afraid to talk to your doctor about any of it, any of your feelings. Don't be afraid to ask questions. Just communicate. And just tell them what your fears are, or how you're feeling, or, you know, you got to remember, doctors are humans too. So, alright, you guys, thanks for watching and going through me with this process. I really appreciate it, and I hope you guys have a blessed day, and I will see you guys later.